Welcome, and thank you for joining us, the School of Public Health Town Hall on Racial Equality and Inclusion. I'm pleased to introduce Dr. Rodney Lynn, Interim Dean for the School of Public Health.
Thank you, Dr. Stauber. Greetings, everyone. I want to thank each of you for joining us today. The recent murders of unarmed Black people, including George Floyd, Breonna Taylor, and Ahmaud Arbery by police, active or retired, have struck a nerve in our country. They've outraged many of us, Black and white, young and old. Unfortunately, these murders are part of a painfully clear pattern of unjust and unlawful police violence against Black men, Black women, and Black children. The inhumane treatment and violence to which Black people are subjected is not new. There is a long history in this country of racism, violence, and police brutality that target Black Americans. The time is now to reform and reimagine policing to ensure all citizens are served and protected equitably, and that there is immediate accountability for unwarranted acts of violence and the murder of Black citizens. I want to acknowledge and commend all those who have peacefully protested in recent days. You've assumed great risk to your health and well-being, marching in the midst of a pandemic and at times facing unprovoked, excessive force and violence from police. As we look at policing in the criminal justice system, any objective analysis will reveal that relative to whites, Blacks are treated more harshly on almost any measure. Unjust policing is but one cog in the wheel of structural racism. And we should be clear that this problem is not isolated. Racism is deeply embedded within broader social, cultural, and historical contexts that use laws, policies, and institutional practices to create norms that maintain privileges associated with whiteness and disadvantages associated with Blackness. Throughout the life course, our culture, if allowed, can socialize us to value whiteness and devalue Blackness. Structural racism, discrimination, and racial inequality persists in this country because many have remained indifferent and failed to acknowledge the great harms that our current structure, policies, and practices cause among Black and minority people and communities. We can and must do more to ameliorate racism and injustice. The recent incident between Chris Cooper, a Black Harvard graduate who enjoys watching birds in parks in New York City, and Amy Cooper, a white woman walking her dog without a leash, was both shameful and revealing. Ms. Cooper clearly understood her privileged social position and the advantage of her whiteness relative to Mr. Cooper's Blackness, and worse, that she could unjustly weaponize the police against him. Regrettably, racism in all its forms is still alive and well in this country. Public health is my own area of expertise, and evidence makes clear that racism and discrimination are damaging to health and well-being. Even before COVID-19 and its disproportionate impact on African Americans, Black people were already suffering from significant disparities relative to whites for heart disease, diabetes, stroke, infant and maternal mortality, and almost any health outcome you can imagine. There's significant stress associated with discrimination. David Williams, a collaborator of mine at Harvard, developed the Everyday Discrimination Scale. His work has shown that African Americans receive poorer service, less general courtesy, are regularly insulted by people who treat us as if we're not smart, or express fear of Black people. These indignities do take a toll. And worse, if you're in fear of unwarranted violence from police, what toll does that take on one's mental health? Dr. Williams recently reminded us in an interview that as we think about equity in health and well-being, we have to acknowledge that the most powerful predictors of your health are income, education, and where you live. For income in this country, for every dollar a white person earns, a Black person earns 59 cents. The Black-white gap for income is the same today as it was in 1978, over 40 years ago. For wealth, for every dollar of wealth or assets that a white household has, a Black household has only 10 cents. In some cities, there's a 20-plus year gap in life expectancy between neighborhoods that are only a few miles apart. These disheartening facts make clear that structural racism is damaging, present tense, damaging the lives of African Americans. Dismantling structural racism must be a priority for the field of public health, and it's going to be a priority for the School of Public Health at Georgia State. There's a compelling need to take action and to respond to the call of this moment for wholesale changes that address systemic racism at all levels and in all our institutions, laws, and policies. A starting point is certainly a focus on policing and the criminal justice system, but we also have to tackle access and equity in areas like early care and education, K-12 schools, housing, employment, healthcare, access to capital, and of course, where we reside, higher education. American society has promoted, accepted, or tolerated racial inequality for too long. History suggests that when realities of racism are laid bare and pressure is applied, people of goodwill respond. We're seeing that today, people of all races and backgrounds joining together to demand change. There's a need to turn protest and growing momentum into meaningful change. Here at Georgia State, President Becker and Provost Hensel have assembled a task force on which I serve. It is chaired by Dr. Jonathan Gales. You will hear more about its work in the near future. Today, I'm here in my role as Interim Dean in the School of Public Health to discuss with you the actions that the school can take to eliminate racism and racial inequality. This will include action within our school, such as review of curricula, hiring practices, admissions, promotion and tenure practices, among others. And it will also include action in partnership with the communities with whom we work. So I really look forward to our time together today. Before I introduce my colleague, I do want to acknowledge the collective trauma being felt by students, faculty, staff, and staff and many people across our community, but especially those who know all too well the pain and anguish that racism, discrimination, and injustice causes. Unfortunately, we've been here before, and we've felt this pain before. We're hopeful that meaningful change will follow, but we're also worried that our hopes may be again dashed by words that are not followed with deeds. I've announced the establishment of a School of Public Health Task Force for Racial Equality and Inclusion, and today we want to hear your concerns about where we are and your suggestions for where we should go, areas of focus for the task force, and how we might go about our work. I welcome you to this conversation. We're accepting and responding to live questions posed by you, so please submit those via email to publichealth@gsu.edu. Now I want to introduce my colleague, Dr. Collins Airhihenbuwa. Dr. Airhihenbuwa is professor in the Department of Health Policy and Behavioral Sciences in the School of Public Health. He's an expert on race and culture and in creating solutions to promote health equity. He developed a cultural model called PEN 3 and co-developed the Public Health Critical Race Praxis. He previously served as Dean of the College of Public Health and Social Justice at St. Louis University. And prior to that, he served as department head for the Department of Biobehavioral Health at Penn State. Dr. Airhihenbuwa, welcome.
Thank you very much, Dean Lane, and thank you for your leadership and courage during these difficult times. Black Lives Matter. And what I'd like to do is make 7 points before we welcome questions to which we will hope to offer some response. Point number 1, racism is a health crisis, and the solution is to dismantle and end structural racism. Point number 2, the lynching of George Floyd by Derek Chauvin with the support of 3 other now former police officers is the culmination of years of violence and brutality that policing and criminal justice system have waged on the Black bodies, particularly Black males. Dean Lane, you've mentioned the killing of Moderator in Brunswick, Glenn County, Breonna Taylor in Louisville, Kentucky, and the deployment of weapons of racism by Amy Cooper on Christian Cooper in New York City. Point number 3, structural racism is also a crisis, not only in health and public health, but also in higher education. And our meeting today is to begin an open and honest conversation that will lead to actions. We must find ways that we as a school can lead the public health profession and institutions, and by extension, higher education institutions, to dismantle structural racism. At this critical moment, when attention is on transforming institutions of policing and criminal justice system, we should focus first on ourselves as a community of teachers and learners committed to actions that will lead to social justice and health equity. Point number 4, for us to succeed, every white faculty, full-time or part-time, will have to be fully committed and engaged. As a Black man asked to lead this task force by another Black man, we are aware of the usual expectation that since we are the ones most affected by police brutality, we should provide a solution. I'm here to say that my chairing this task force in no way suggests that I have the solution. Even if we did, we do not hold the power or the resources to implement, institutionalize, and sustain it. As I draw on the spirit of those who have passed on to make it through these difficult times, I'm reminded of what the late Toni Morrison wrote in The Source of Self-Regard. She wrote that she turned down several invitations from university to speak on the issue of how to understand the perpetrators of racism, because she did not believe that victims of rape should be expected to explain the psychology of rapists. We are meeting today because, as Dean Lynn has noted in the previous communication with the school, we cannot go back to business as usual. I see my role as facilitating difficult and challenging conversations in ways that welcome spaces for anger, shame, self-admitted ignorance, and other otherwise stigmatized emotions to be expressed, with the goal of channeling these energies into actions in our teaching, our research, and our community engagement. I can help to challenge your thinking about this crisis, as I hope you will challenge mine. In the end, we need you to lead in the solution. Number 5, our conversation should focus on what we as faculty, staff, students, alumni, and community members should do first to name the problem, engage in how we structure solutions in ways that they can become institutionalized. For example, drug addiction remains at the intersection of public health, policing, and the carceral or the prison system. We can draw lessons from how Black bodies were criminalized and continue to be as individual failures during the crack cocaine epidemic, first in the different punishment that resulted in higher incarceration rate of Blacks for the same amount of crack cocaine compared to powder cocaine for whites. And secondly, today, in the ways in which the opioid epidemic has been acknowledged and embraced widely, and rightly so, as failure of the system and state rather than criminality of the white body. Number 6, before being asked to chair this task force and also serve as a member of the university task force along with Dean Lynn, I have been a part of a network of scholars and activists committed to anti-racism research and practice. This network is led by Dr. Chandra Ford, who is the director of the UCLA Center for the Study of Racism, Social Justice, and Health. And she also led the development of the framework on how to apply critical race theory to public health, which we call the public health critical race praxis. We have committed to 4 principles, which I'm happy to share with those who may be interested at a later date. Number 7, and my final point, If you ever ask yourself, how do I begin? I would like you to think of and remember the name Donnella Frazier, a 17-year-old who stood still in the face of horror and terror and recorded the video that shows the 8 minutes and 46 seconds lynching of George Floyd. Audre Lorde warned us that your silence will not protect you. Dr. King reminds us that not protesting against evil means you are accepting it. To end structural racism, one is either on the side of racism or on the side of anti-racism. There is no middle ground. We need actionable solutions. The time is now. And with that, I'll turn it over to Dr. Stauber.
Thank you, Dr. Airhihenbuwa. What will follow is I will be posing some questions to Dean Lin and Dr. Airhihenbuwa that were sent to us via the email. And I will just start with the one that I have in front of me. These questions come from students, alums, and others. The first one is focused on access to resources for students. And in particular, it's addressing how is the School of Public Health addressing the mental health of their student body? Will GSU School of Public Health and GSU provide a list of adequate, free, and accessible resources for Black students who need professional help to navigate the current political, economic, and academic circumstances? Currently, the GSU Counseling and Testing Center is not adequately staffed to address the mental health needs of students. Following the initial counsel, there is a wait time of 6 to 8 weeks for the counseling center assigns students to a counselor. There's also a wait time for initial counsel. The counseling center repeatedly encourages group therapy, but given the current pandemic, the political climate, and racial tensions, we demand GSU hire more trauma-informed counselors to be proportionate to the student population enrolled. So I'll leave it there, and there are a couple of follow-up questions for that.
Okay, thanks, Dr. Stauber. Very important question, and we've really learned over time the importance of a commitment and a focus on mental health. And I appreciate this question illuminating challenges that students are facing. What I can commit to is that both through our task force and my role on the university task force, that I will highlight these issues and advocate for additional resources to ensure our students have the support they need. In the School of Public Health, we've previously worked with the counseling center, brought counselors in to ensure that our faculty are trained. We've actively partnered with them, referred students there, but we do need to make sure that we have the resources to meet the needs that students have. So, I'm pleased that public health is a field that's actually acknowledged the importance of mental health. And again, I know I speak for Dr. Airhihenbuwa as well, that we, as members of the task force, will shine a light on and look more closely at the available resources that our students have as it relates to access to counseling.
Thank you. As a follow-up to this, the follow-up question is, how will GSU School of Public Health recognize and take initiative in addressing the trauma that Black students are facing?
I'll start, and maybe Dr. Airhihenbuwa can respond as well. I think one of the goals of the task force in the School of Public Health is to look across the entire school and look at all the ways that we can do things differently, change policies, ensure a welcoming and nurturing environment for African American and other minority students. So the reach of the task force is really about a comprehensive review to ensure that our students have what they need. As it relates to curriculum, there are a couple of things there. I think sort of trauma-informed pedagogy and instruction is something we need to look more closely at. and see what we can do as faculty, as instructors in the classroom. We have an incredible responsibility in the ways that we engage our students, and we really need to look at what we're doing and see how we can improve that. I know that there's power in the way that we instruct, because there are narratives, stories, and scripts in the ways that we talk about what's happening in the world, the way we talk about different groups of people. And so there's a real need for us to revisit. And, where faculty don't have the experience or the training or the comfort, it is incumbent upon the school to provide the resources to support faculty, to listen to students, and to ensure that we're making changes that move us toward the goal of a just and sort of a society and a school that where racial equality is how we operate, not just the way we think about in our personal commitments, but actually what we do and how we structure the institution and the school.
Just to add to that, I would fully agree. I think in terms of courses that we need to offer, that is something that we are going to be discussing. I know last fall when I taught the course on health disparity, we spent a great deal of time addressing the issue of structural racism. Students were very excited across the board to understand this issue and understand how we take it on as a collective body. I also recall when I gave the Curakas lecture and I talked about health equity at a space where a crossroad that may seem busy, but that is really where we all need to be. And that messiness is what we need to embrace in order to move forward. I still remember Dr. Hyman asking me in the classroom how professors can begin to think about this complex nature of structural racism, structural discrimination, so that the teaching is able to take into account these structural issues that we need to bring to bear in the work that we do. And that has led to subsequent conversation that a number of us have had. But the moment actually allow what I talked about earlier in terms of the opportunity or license, if you will, for individuals to know that it is okay to be angry, it is okay to be even ashamed, and it's okay to have self-admitted ignorance about some of these issues, that within that space, we will begin to work on how faculty can play a more direct role in the ways in which they offer instruction. As a grad student, and I've talked about this at lecture, when issue of the disproportionate burden of disease in the Black community, whether it's domestically or in African community were brought up, there are times where I wanted to hide under the table because eyes are on you as though you want that. It's almost like there is a need to feel pity for you because you are in the classroom. So what this moment offers us, which is why I use the addiction example, is for faculty to go beyond the way we typically address issue, public health issue and disease burden, and begin to broaden the conversation to address the structural issue, the structural determinants of the burden that we talk about in ways that allow everyone to appropriately focus on not just the individual level behavior that we tend to prioritize, but the structural institutional level behavior and policies that needs to be changed to bring about a dismantling of structural racism.
Thank you, Dr. Airhihenbuwa. Following up on that, around the curriculum, we have a question that was posed, and it goes the following. Race medicine, unfortunately, occurs in this country, as do race education. which allows those with financial means to get the best healthcare and education money can buy. Are there discussions for either creating a new course to address the growing inequities or incorporating it into existing curriculum? And if we don't include it in the curriculum, we don't have a chance to solve it. So I know you're addressing this, but if we could think about it perhaps in a broader scale.
Thanks, Dr. Stauber. Dr. Airhihenbuwa and I have already had some conversation about this, and while much of the course he is currently teaching on disparities in health covers race, we agree that there's a need for a course and a focus on structural racism in public health. So, I expect that to be something that we can do more quickly as something that's fairly immediate. Beyond that, though, we have to be careful not to say we have a course and so therefore we've done the work. What we need is for all faculty to serve as leaders and to take this issue up and work on their respective courses to ensure that the ways that they are talking about issues of race, racism, and structural racism are appropriate, and that they tie in well to the overarching goals that we all share around racial equality. But as I said before, there's a lot of power in us as faculty. We create knowledge, we shape narratives, and we train students that take those with them for better or for worse. So we have work to do there, and I'm confident that we will.
If I can just offer an example to further highlight what Dean Lin just shared, you would have heard that we have two pandemics going on, COVID-19 and racism. I'm speaking to you from State College, Pennsylvania, and I plan to be in Atlanta in a week and a half. So I've had this conversation with my wife about when I go back, and because COVID-19 was on everybody's mind. As someone in public health, the thinking always is how to mitigate risk. So the question is, do you fly or do you drive? And of course, the conventional wisdom is that, of course, if you have a choice, you want to drive, because the chances of getting close to someone and putting yourself at risk will be less if you drive compared to if you're in a congested aircraft and you meet a lot of people. But that is if we're thinking about one pandemic, that is COVID-19. If you couple that with racism, which is what I was thinking about, and I had to break it down to her and two other friends who've offered the same advice, that when you add racism to it, I now have to think about driving through 4 or 5 states, the likelihood that I might be stopped by a police officer. In the absence of anyone traveling with me with a camera, what might happen given what we're experiencing? Now, the question is not whether or not I actually end up flying or driving. So when we talk about the stress of what racism imposed on the body, and we study allostatic load, we study telomere length, we study different ways that trauma impact on the health of African American that result in some of the NCD outcomes like hypertension, diabetes, and other conditions that we know is being always, there has been a heavy burden in this community. So I'm dealing with the issue of rethinking the meaning of risk beyond just infection or exposure to an infection, by coupling it with exposure to a potential risk because of racism. And these are, a one class cannot, it's not sufficient to address this. Faculty members talk about risk in their classroom. A part of what we need to do, why I say I'm challenging everyone to be involved in this, is rethinking how to expand that calculus for risk to go beyond the way we conventionally understood risk. If you remember the traditional epidemiological model of host agent environment, but the environment is more than just the agent of COVID-19, is racism, coexisting with it, is to rethink and reimagine, as Dean Lenny said, the way we engage in instruction and the way we work with our students, and then the way we work with our community. And that is going to take everyone becoming fully, as a full participant, and not waiting for one class to offer a solution.
Thank you, Dr. Airhihenbuwa. Maybe I could follow up on that with another question, which says, how is the School of Public Health working to ensure that the instructors, and I would like to include, not just part-time, but full-time, are encouraged to challenge their own biases and perceptions about student achievement? We all have them, whether we want to admit it or not, but also I would say go beyond and think about these challenges that we face in terms of instruction.
Yeah, it's a great question, and I think again, an area where we have work to do. Certainly, the issue of racism is something we talk a lot about in public health. So I don't believe this topic is new to our faculty, but certainly there is variance in life experiences. There is variance in the extent to which individual faculty have studied the issues that we're discussing, and we're all bringing a lens that's reflective of our own, cultural background, racial background, life experiences. And so I take this point that there's a need to institute an approach in the School of Public Health that allows for ensuring that our faculty and our instructors have the tools that they need, understand the biases they may have. That's including white and black, and wherever you come from, whatever your background, you're going to bring biases. And so ensuring that we can institute training and provide resources to help all of us understand the biases that we bring to our work, I think is critically important. And so I expect that that's something that we can also do fairly quickly and not need to wait months for a recommendation. So that's something I'm confident that our faculty is going to embrace because they're, our faculty take their work very seriously and are familiar with the things that we're talking about and want to make a positive impact.
And what I might add to that is that if you had asked any faculty member, particularly those of us who've been at this for years, in February or January, that you are going to stay at home for about, 6, 7, 8 weeks and deliver your instruction only online. And not just you, that every single person who is a faculty member will be doing the same thing. We will be saying that is not possible. It just can't be done. But COVID-19 made it very clear that if there is an institutional will, there would be a transformation, not unlike what you've seen previously. We all went online, including part-time instructor who may have thought they would never deliver instruction using this medium. It required institutional support from the university and from different schools and colleges. If we really treat racism as the second epidemic, I have every confidence that we can bring the same level of urgency and institutional commitment to bear on what needs to happen. It cannot be business as usual. We've tested it that you can't transform the way we do business and do it within 2 or 3 weeks. It took to do the transformation. I believe that if there is a collective will, we can make a difference.
Great. Thank you so much, Dr. Airhihenbuwa. I would like to maybe use one message from a current student. I will read this and then we can have your feedback and comments on it. This student has addressed a number of different areas that we've already kind of covered, but I thought I would just read this statement. In general, we demand acknowledgement of collective Black death at the hands of the police. Lack of collective acknowledgement perpetuates erasure of anti-Black experiences of violence and further highlights struggles of GSU faculty to address the ways anti-Blackness impacts the collective Black community, which includes trans people, disabled people, migrants, women, men, and gender nonconforming individuals. With regards to that budget, we demand that GSU School of Public Health designate a portion of their academic budget to create research and training opportunities for Black faculty and students, to provide robust mentorship opportunities and contributions to public health research examining the impacts of structural racism on health, especially among Black communities. We demand that public health create and enforce comprehensive racial awareness and inclusion curriculum across all academic units and departments, mandatory for all students, faculty, staff, and administration. This must be vetted, maintained, and overseen by a board of students, staff, and faculty of color. For example, the Department of Biostatistics should include a mandatory semester-long seminar discussing the intersections of data science and health equity, consider the prospect of a collective historical and community trauma and individual trauma course of some sort. This task force would be a good place to advocate for it as a longstanding beacon of inclusivity, understanding, and reparations, since SPH students go on to influence program and policy. And then the last statement is, we demand by 2023, GSU Public Health increases the percentage of Black faculty members school-wide by 10%, ensure added Black faculty are not stalled in lecturer positions, and restructure the policy that makes faculty responsible for raising most of their salaries by outside grants. This is a structurally racist policy to uphold when research shows Black scholars are granted less money than white scholars in this country when they desire to study groups underrepresented in health. So a broad statement, I can come back to any of the comments, but it's covered many of the things we've sort of discussed. And so I thought I would put this there for us to sort of discuss.
Yes, that's a lot, but all relevant to the discussion. And I think the work of the task force is really to take on that body of issues and opportunities that are listed in the statement. I think that, you know, we've made progress in the School of Public Health in my time here. I think in 2012, we were, in terms of our student population, about 35 or 40% African American. Today, we're almost at 70% African American, and that's not because we admitted fewer white students. So, you know, we've looked at the way we do our admissions and looked at the practices that disadvantage students of color. We will do that again. We will review the school more broadly across these areas, the issue of our budget and how we use resources. As I've come into the role as interim dean, I've been very transparent with the resources that we have and how we use those resources. I intend to continue being transparent about that. So we're going to commit what's necessary to implement changes that the task force recommends and that we have the capacity to do. So that's my commitment.
And what I might add to that, and thank you, Dean Lane, is that it is great to hear the students are engaged in this and have thought through some issues that they're sharing with us. It's often the case that we tend not to do a good job at listening to students. And we forget we were one student ourselves, and we may have made a request of institution. And so I'm very happy to hear from a student. A part of our role and responsibility is to also be able to break things down so that students understand where the power and resources lie within the institution. Some of the requests that are made are valid requests, but whose authority and resources really does not lie within the school. But we cannot nonetheless ignore it. It gives us, as a school, the opportunity and the tool that we need and the evidence we need to make a case at the university level to the provost and the president to say, it's not just us asking about this, the students are aware of it, and there are things that we need to be paying attention to. And particularly like the reference to the need to have a coalition of others who've been traumatized, the sexual minority and other groups who've been traumatized. If any lesson we've learned from the civil rights movement, it was a collective effort, but the eyes on the prize has to be kept focused. That there is a reason that we are here. It's going to take a collective effort to achieve the goal we want, but we must not lose sight of the prize.
Thank you, Dr. Airhihenbuwa. I would just have a follow-up to that to say, in terms of what are some of the challenges faced by members of historically underrepresented groups, either in the School of Public Health or in academy, and what are the strategies to address these challenges? How can we mentor historically underrepresented groups to increase their advancement within the academy?
So if I can just offer, I have to say that university, I came to Georgia State in 2018. In 2017, President Becker and the former provost had established a commission for the next generation of faculty. And this was born of the concern that we don't have the level of diversity that we ought to have at the university. It was, how do you diversify the professorate? And when I came on board in 2018, I was asked to join that commission. And we, of course, released our report in 2019. This was last year. Immediately after the release of the report, the new provost established a new task force to implement the key recommendation from that commission. And I was asked to serve on it. I can say that the report from that task force implemented the first phase of the first year was recently, in the matter of 2 or 3 days, just sent to the provost. I'm not sure that she's had the time to even review it. But I say this to say that the question that is raised about mentorship and how do you ensure that the university is welcoming to faculty of diverse background and the recruitment, but retention, that people actually feel a sense of home, that they stay. And those were some of the key recommendations that came out of the that implementation task force and will be broadly shared, I'm sure, as soon as we are able to start having gathering, maybe even using one of these forum to share some of the initial recommendations. I'm saying that to say we're talking about this issue, but some groundwork was already in place because the concern was already there that we needed to do more than we are doing now at the level of recruitment, at the level of retention, and within retention, the whole issue of mentorship, which goes back to some of the requests and demands students made. How do we really calculate what is rewarded in the university? If you are focusing on issues that brought us to this point where faculty members were not always rewarded, it's the entire system. We can look at NIH, NSF, what is prioritized for funding, and it goes beyond even the university. So it is, there are certain work already in place, and through our own task force in the school and the university task force, we're going to make sure that these points that are being raised are echoed in those meetings.
So I would like to shift a little bit the conversation to think about sort of some of the questions that we've had about interaction with police and from a GSU perspective. And so these questions are about the police department, the Atlanta Police Department, and engagement with police force on campus, etc. So the first question is, will GSU Public Health follow the leadership of the University of Minnesota and no longer contract with the Atlanta Police Department for large events and additional law enforcement support because it places Black students, faculty, and staff at risk? And then separately, will GSU Public Health advocate against increased policing in the neighborhood of downtown Atlanta as a means of student safety? Black students and non-students do not feel safe around the police. Will we redirect funds used for policing to mental health and transportation services for students and community members? And then the last question is about partnership with foreign governments like the GILEE partners, where they use foreign governments, law enforcement agencies, and Atlanta police officers train and dialogue with foreign governments. So the question here is, will GSU School of Public Health take a stance in suspending GSU's participation in these programs, these type of programs where they put Black students, faculty, staff at risk?
Okay, thanks, Dr. Stauber. The issue of police brutality and unwarranted violence against African Americans is something that I acknowledged in my statement because I think it's important for us to acknowledge what's happening. We see it, but we also need to hear it acknowledged. I think from the School of Public Health standpoint, I, as dean, have not had direct interaction with the police on campus in terms of hiring, contracting, things of that nature. It's just not a part of my role in the school. And even for events, I'm not aware of any direct role we have with either Atlanta or the on-campus police. I think given all that's happening right now, both Dr. Airhihenbuwa and myself, and I'm sure the entire task force that the provost has put together, will be reviewing the issues that you've raised. The program that you've mentioned, I'm not familiar with it. I don't know how it operates, but we do need to ensure that the university leadership and police are aware of the evidence that's available, the concerns that citizens of the community have, legitimate concerns, and that those are carried forward and responded to. But we also need to recognize that public safety is important, and law enforcement do have a role to play in our community. We need to reimagine and rethink what that looks like, but I'm not sure that no police presence is the right response either. So this is a important and complex topic, one that we're going to take on probably more at the university task force level than in the School of Public Health, because we just don't have purview over it. To the extent that we have data and evidence and can inform models that are being used around the country at other universities that have value, then that is our responsibility to contribute to the dialogue and conversation in a way that is proactive and puts forward potential solutions that protect our students and ensure safety for everyone. So that's what we're going to be working towards. I know Chief Spillane and have worked with him as part of the University Preparedness Task Force. He's made himself very available across the university as these events have unfolded. And I know he's willing to engage in dialogue and conversation about how the police department operates, programs that they're a part of, and the types of things that may need to change going forward.
Well, I fully agree with Dean Lane. We have a dynamic mayor in Atlanta who is fully committed to a number of the things that has been identified. I think as it relates to foreign government in terms of law enforcement, look, it is how you structure your house that you define with whom you want to have a relationship. If you have a house that is built on prioritizing weapons of destruction, whether it's mass or singular, then the tendency will be to align and to look for others in a global arena who might help to reinforce what you have prioritized. If we restructure our home to de-emphasize certain tools of destruction, recognizing that public safety is very important and policing is important, provided this protection is at the same level that are accorded to the white community, then the people with whom you collaborate may very well be, how do we address the major mental health issue that we face in our country? It's something Dr. Sasha is written and spoken about broadly. We have a system of activating emergency when a situation arises. Some of the things that is being talked about around the nation is, if you call 911, someone is having a heart attack, you activate the ambulance. If the house is on fire, you activate the fire department. If it has to do with mental health, who do you call? And so when the conversation about how you restructure funding, there's been debate about you defund, what does it mean? It isn't a question of getting rid of public safety and that some measure of policy is still important. It's a question of where are you placing the emphasis for public health. We are saying mental health is so important, it's been long ignored. There has to be a way of folding that response into existing structure so that if you have a situation where mothers have called 911 for support or help for their children, we had a situation here in State College where a father went out to police and said, help me, my child has a mental illness. I don't know where he is. The next day, the police killed him, saying that he had a knife. And this is a friend, it's a child that I knew. So where do parents go to activate that support for someone who has mental illness? So that is the reimagining that Ding talked about. That is what we have to be thinking about, is the structure. How do we want to restructure our home so that when we think about what we currently have, let's not throw everything away. Let's sustain what works, what we need. Let's begin to look at what is not working, because it's not, it may be working for some population, it's just not working for the majority of population.
Thank you, Dr. Airhihenbuwa. I will say that we have about 8 minutes left, and so I wanted to have one last set of questions that's specifically about the task force. And it says, how will we ensure that the task force that is proposed is composed of a diverse group of students, staff, and faculty that are able to catalyze fundamental change within the School of Public Health? What kind of financial funding will the task force be allotted? What type of compensation will students, faculty, and staff receive on this task force for their time and efforts? How can we ensure that the task force recommendations will be implemented? And will the task force be given access to all SPH funding data in order to ensure that resources are being equitably distributed?
That's for Dean Lee.
Yes. So the task force has a very important role, and I want to, I guess, be sure that people know that the task force will be a reflection of our community, and it will be a diverse group. And I wanted to have this town hall, though I have individuals that I, in addition to Dr. Airhihenbuwa, that I am planning to ask to serve on the task force. I certainly wanted to hear from you about areas of focus, concerns you have, because all those things go into choices about who will serve. So this is our community. And so, there's a question there about compensation for task force members. And, I'll be honest, my expectation is that we all come together and work on this because we care about one another and about these issues. And so I would be surprised if people came forward with a request for compensation, given the larger mission of what we're trying to accomplish. So I'm confident that we're going to have a group that's really enthusiastic, diverse, inclusive of students, inclusive of faculty, inclusive of staff. One of the first orders of business for the task force is to discuss structure. And there'll be initial members, but that may expand. How do we engage with the communities with whom we partner? Those are questions I think the task force needs to think about and respond to. I'm really committed to a process that allows for diverse representation, dealing with the issues at hand. The question about finances, I said previously that the finances of the school are not a secret. You may or may not be surprised to hear that 97% of the dollars we spend are for personnel, faculty, and staff. So there's not a lot, after you do that. But nonetheless, I'm happy to have a conversation and share information about how the school is using its resources. It is an important question, and it's something that I'm certainly willing to do with the task force. So you're going to hear early next week, I'll announce the initial members of the task force, and they're going to immediately begin their work on these issues. So, Christine, there was a lot there. I hope I got to most of it. I don't know if Dr. Airhihenbuwa has any response or additions to that.
No, I think it's you covered it, and perhaps a part of what is implied there is the additional responsibility that you and I, others may be expected to take that doesn't carry compensation. I mean, you're absolutely right that you don't get extra pay for this, but it does speak to the other responsibility that we have to take on and that we are committed to, because the goal is to achieve what we set out to do, and hopefully the payoff will be more in the dividend that derives rather than what we each gain in terms of remuneration.
Yeah. Well, thank you, Dr. Airhihenbuwa, Dr. Stauber. I just want to make a few closing remarks. First, thanks to all of you that made time to join us today and that submitted questions. I think if we look back over history as it relates to racial equality and justice, there have really been moments where the country has really stepped forward and there's been measurable progress. Whether we go back to the Emancipation Proclamation or the 1954 Brown versus Board decision that ended Jim Crow era segregation, the Civil Rights Movement and the Civil Rights Act and the Voting Rights Act, all the things that have come out of that have been critically important. And so I think it's important for us to ask, what will this moment produce for social and racial justice? That question is really left to us. Now is our moment to make an impact, to move our society significantly forward on these issues. The task force is really charged with identifying actions that the School of Public Health can take to address and reduce systemic racism, discrimination, and police violence against Black people, but also other underrepresented groups and groups that are unjustly discriminated against in our university, community, or broader society. So as I mentioned, by early next week, I'm going to announce the initial members of the task force, and they will commence their work. We're going to need to take action that's specific within the School of Public Health, but also things that are external to the School of Public Health. I made the case earlier that racism is a public health issue. There's a body of literature and science around it, and it really says to us that this should be a central part of our work in the School of Public Health. We're going to need your participation and engagement. And so, please continue to stay engaged with us, share your thoughts, your ideas. We need you. So I really want to thank you for joining us today. I really look forward to advancing this work together.
Thank you, Dean Lynn. I will say that concludes today's School of Public Health Town Hall on racial equality and inclusion. And if you have questions or comments questions we didn't answer yet, please direct them to publichealth@gsu.edu. Thank you for joining us today.